Today's Fridays with Feldman is a little unusual. I'm going to be discussing a topic that really crosses the line. It starts with arthrogryposis, and I'll mainly be talking about the follow-up of arthrogryposis. What happens when you run a practice or when everybody travels for medical care? What do you do when you go home? I think that it came up recently with a patient, and I mean, there's frustration on everybody's part. Frustration on my part that we didn't get results we want, on the family's part because there's been a setback, on the therapist's part because could we have done better? And I think we need to have a sort of understanding of what happens when we do surgery, let's say in West Palm Beach, or for us in Poland, or in UAE, or in Israel, and then we leave, or the patient leaves, or you go home. And so what do you do, and how do we maintain our function? So arthrogryposis is a really good one to discuss that with, because it is a stiff jointed disease, and it is going to recur in a time when people are growing, in the time when kids are growing, because the muscle length or the soft tissue length just doesn't keep up with the bone length. So the bone length goes, and all of a sudden you can get contractured again. So I think that we've tried to set up mechanisms in place. And even if you live in a rural area without any support, with telemedicine these days, it really is possible to have the result and outcome that we want and that you want for your child without feeling like you've been abandoned by us when you leave here. And I think that that's really crucial for me to portray from all of us, for myself, Dr. Hoosier, Dr. Hariharan, our head of our therapy, Dr. Guardo, or all of our therapists, all my PAs. We are available to you first by email and then also by telehealth. So before you go home, let's say you have arthrogryposis and you had a knee that was bent and that didn't extend, or that was extended very straight and didn't bend. And we did these releases and we got the knee straight, or we got a straight knee to bend, and we have braces made, and it's working great. 6 months, the child's walking, the child's more independent, things are happening. You should have gone home with hopefully a disc or a jump drive that shows what to do with continued therapy. But all of a sudden, life gets in the way. Don't have time for therapy. There's no place to go to. Your therapist is out on maternity leave or got sick, or you just can't go anymore. The braces don't fit anymore, and your orthotist at home has never seen a child with arthrogryposis. So then that's when really telemedicine comes into play, where we can have a Zoom appointment. Myself, I know that our therapist who Dr. Guardo deals with will be happy to talk to you. My PAs, my partners, we can really understand the problem and try to figure it out and work either with your orthotist there, with your therapist there, or even just having you do the home therapy. Okay, what's going on? Why are we losing the function? Why are we losing the range of motion? And I think that for me, and someone who does 85% of surgery on people not from locally, who travel to see us when we do surgery, this is exceptionally important that we don't get frustrated. We as practitioners, you as parents, or patients, or the children, really know that we are there for them. And I wanted to make sure I made that clear, but certainly my group and myself are always there for you, and you can always reach out if you feel like the brace is not fitting, we're losing something, it's just not happening the way you want it to. And not everything always goes exactly as we want it to, but we certainly can have interventions with occupational therapy, with physical therapy, with orthotists, with ourselves, in trying to figure out the next step so that it's not in vain that we do this work and that we try to work so hard for the children. So I think particularly with arthrogryposis, it's why I chose it as a topic, because it is a condition that may worsen as a child grows. It's one that we do need plans moving forward. So there should be a plan when you leave West Palm Beach, or when we leave Warsaw, or when we leave the UAE, or in Israel, or when you go back to your home state from wherever you are and wherever we are at the time, and we really have a plan that makes sense and try to see that that plan is working. Happy to work with the doctors there, happy to work with the therapist, with the orthotist there, and with you. You really do become your own therapist after a while as well, because you've seen so much of it while you're here, and they're so good at really maintaining what we have. And maybe we can get you back for a week, for some therapy, which always helps. So I'm reaching out because we are publishing now a 5-year follow-up of the knees that we've done in arthrogryposis, and the results are great. But the The results that aren't going to be great are the ones that we've lost contact with, that the patient couldn't continue the therapy. Or, I mean, again, there's also sometimes just very low muscle function and things like that. But in many cases, that's been our one factor that we think that we're losing what we've gained, or some of the loss of what we gained. So we're here for you. You can always reach out to us by email. I did put our email addresses. That's myself, Dr. Hoosier, Dr. Hariharan. The PA is just below that, and Dr. Guardo's email is right below that. So you can just save this on your screen and email any one of us. So again, I don't want you to be frustrated. This is 2024. Happy New Year to you all. Happy holidays. So we're going to move into a new year with looking forward to greater and brighter futures for all of us, for the world, hopefully. And looking forward to seeing you and speaking with you in the near future and very soon. So again, happy holidays, happy New Year, and we'll speak soon. Take care.